disorder or psychological process that I chose to go in depth about is anxiety. The technical term would be generalized anxiety disorder. Uh, Basically, what it is categorized as is an unusual or a lack of control over one's worries, so the inability to control what somebody worries about most often. I really chose this because it's involved in a lot of the college students, and that's what we are. It's the highest majority of people around us that we would see. I also chose because I think that people have a lot of control over the way that they think, and I wanted to see if this is actually a problem that they can't control, and I'm open to that, and I believe that it has persuaded me. So I started off with a little bit of research and found out that generalized anxiety disorder affects 40 million adults in the United States, which is about 18% of the population above 18. And it costs the United States about $42 billion annually, which accounts for 1/3 of the nation's $148 billion mental health bill. And anxiety disorders in general, like generalized anxiety disorder, are commonly due to a functional hyperactivity in limbic regions, mainly the amygdala. So when compared with something similar like major depressive disorder, the levels of hyperactivity are the same, but for generalized anxiety disorder, the hyperactivity in the amygdala does not come until after some provocation or some event to trigger it. So after learning about it, I was curious to see if it was produced by other non-physical disorders. I found a study that was linking it with cancer, cancer patients and their susceptibility to psychological disorders, and they found that cancer, generalized as malignancies, does have a psychiatric morbidity that manifests itself mostly in the form of depressive disorders and anxiety disorders. But of course, logically, there is no connection between having an anxiety disorder and getting cancer. But and then I also found a survey or a kind of a study done on treatment, and it is the newest wave of treatment, which is using apps on a phone or some other technological device that allows people to download certain set apps for what they have, what disorders they have. And 90% of the participants in the trial completed the 8-week trial, and almost, I think it was 30% left with no symptoms or in full remission. And that was for depression. The anxiety, it was about 40% left without any kind of symptoms. So I'm glad that I did this. It kind of opened my eyes to a fairly specific but prevalent problem with people my age especially.